Healthcare is a space where artificial intelligence is profoundly changing every part of the industry. Imaging is getting millions of times better because of the way artificial intelligence is allowing it to analyze things like MRIs. Patients are having to spend less time in MRI machines because artificial intelligence can measure their breathing and take clearer pictures. And when those images are done, physicians are changing the way that they have to analyze them. Artificial intelligence can also look at a brain scan from an MRI and identify a normal image with almost perfect accuracy. On one hand, that means radiologists can focus their time on the abnormal scans, which are important. On the other hand, normal scans are about 80% of what radiologists have to look at in the first place. And so that reduces the amount of work they have to do by 80%. What impact is that going to have on the role of radiologists in hospitals? We don't know at this point, but it's a great example of how AI is really shifting the work in the industry. We also know that AI can detect diseases before human physicians can. Again, looking in the imaging space, researchers in the UK have found that AI can identify patients that will go on to develop Alzheimer's with almost perfect accuracy, and 6 years before a human physician could detect that disease in their brain scans. What does this mean for healthcare? The fact that we're able to do this not just in imaging, but with data from lots of different sources. On one hand, it's going to make patients' lives better. They're also going to help physicians in making decisions. On the other hand, it's not clear when is it going to cause problems, how is it going to do that fairly, and are patients going to understand and trust the decisions that are made? There's also examples that show we should be worried about that. There's one quick example of a hospital that was using artificial intelligence to determine if patients with a lot of comorbidities would be referred into a program with a lot of specialists and additional support. What researchers found when they looked at it is that Black patients had to be much sicker than white patients to end up getting referred to the program because of a lot of societal issues that change the way Black and white patients interact with the healthcare system. The good news is that researchers were able to correct for that bias. The bad news is that system had been in place for a long time, and a lot of patients that needed and deserved that care weren't given it, basically because of their race. So this highlights a lot of the issues that we're going to talk about in this presentation. What we're going to look at is the way that artificial intelligence is transforming the healthcare industry, the ways that it will make patients' lives better, but the additional protections and considerations that healthcare systems will have to put in place around issues like fairness, auditability, reliability, and educating patients on how these systems work so they trust what healthcare institutions are doing. Ultimately, there's tremendous positive progress that's being made, and healthcare will get better because of artificial intelligence. But there are a lot of challenges that come both from the fact that this shift is happening very dramatically all at once and managing that right now, and preparing for a future so this technology can be used in a way that is beneficial for all patients and managed well within healthcare systems.